sat with people, I've loved people, I've held people, I've been present with enormous suffering.
Yeah, okay.
I saw this one little girl going in for surgery, and she was terrified. She was absolutely terrified, and my only role was as a witness.
16 years ago, Shay Bider was a pre-med student learning a hard lesson, that healing and hurting can go hand in hand.
So I got to experience her going under anesthesia in a state of immense fear. And something in me in that moment just said, no, it doesn't have to look like this.
Shay set out to help sick children and their families as she had helped others for years, through touch.
As I was putting myself through school at UCLA, I was working as a massage therapist. And through that work, I had worked with people who had heart surgery and cancer, who had had very significant losses and were grieving the death of a partner. And I saw how nurturing and comforting that work could be during incredibly trying times. And so I started a program just by simply bringing in gentle touch and massage to children in the hospital.
Over time, Shay's program and her vision grew into the Tucson-based nonprofit Integrative Touch for Kids, which serves children with any special medical need, whether it's an acute illness or a lifelong disability. To do that, Integrative Touch for Kids, or ITK, offers a variety of programs, from a week-long retreat for families to ongoing support groups and playdates, as well as massage and other therapies for hospitalized children and their caregivers.
When a child has special needs, a family has special needs, period. You need to care for, support, nurture, and treat every member of that family. And that creates a direct experience of support that helps them to endure things that sometimes in that moment they don't think that they'll be able to endure.
Okay, this goes on the other side.
Bree Seward has had moments where she doubted what she could endure. She's the single mother of 2 boys, 2-year-old Julian and 5-year-old Sebastian, whose medical needs were a mystery at first.
Around 2, there started to be a difference between him and peers. There would be times in public where he would just put himself down on the ground in the middle of a mall or museum or huge places, just put himself on the ground and kind of hug the floor. It would hurt him when you put on lotion and sunscreen. Or doctor's offices, there would be screaming, holding down, and you just think, well, he doesn't like doctor's offices. Who does? But doctors would be like, this is crossing the line. This isn't necessarily normal.
No.
At 3, Sebastian was diagnosed with autism. Shortly after that, Julian was born 3 months premature, and for a time had problems with his underdeveloped lungs. With help from her parents, Bree juggles caring for her boys with keeping track of their physical, occupational, and speech therapy appointments and advocating for their educations and medical care.
Your day off. It's like looking at this mountain right now that I need to figure out myself while I'm trying to be a mom and just do, let's play trains on the floor, what do you need to eat, let's make sure you get your vitamins. And there's no class for that. There's no like, you're a mom, if you're a special needs mom, sit down and these, you just have to learn on your own. Okay.
Bree learned she wasn't on her own when she and her family took part in an ITK retreat.
And they really take care of us during that healing retreat and teach us that it's okay to take time to yourself, because that's the only way you can care for other people, is if you're good and if you're rested and you're well. And it just gives you such an opportunity to come together with other families that are going through the same struggles. We went on their healing retreat last summer, and we came out of a week of this healing retreat different people. Climb, you can do it.
Bree says Integrative Touch for Kids has transformed her boys as well, particularly Sebastian.
He's not stuck in a room lining up cards anymore. His world's expanded. A village has helped make him who he is, and part of that village was ITK.
Despite the benefits that Bree and other participants report, ITK has met with resistance over the years, in part because it embraces some complementary and alternative medicines that haven't been scientifically proven.
Many of us in traditional medicine, we never thought of alternative therapies. These techniques, they have a value because we are hardcore scientists. We base everything on science, not on touch or healing.
Dr. Faiz Gishan is physician-in-chief of Diamond Children's Hospital and no stranger to the lesson that shaped Shay's life.
I'm a pediatric gastroenterologist. In that capacity, I see kids with gastrointestinal problems, and then I do endoscopy in those kids. The little ones, they have to wear masks. The older kids, we have to put an IV. And those are two traumatic things. We used to chase them sometimes in the hallways to give them a shot to sedate them, and then we cut them and put them on the table to do the procedure.
I know we've worked on the mom. I don't know that we've worked on the child.
The first thing I met Shay, she came in one day with one of my patients, and she asked me if she could do an integrative touch, healing touch, to calm him down before I do the procedure. She put her hand over his chest and rubbed it a little bit, and all of a sudden, this young man is almost asleep without anesthesia. And I was so impressed. I said, oh my God, Shay, from now on, every time I'm going to do a procedure, you need to come and basically do whatever you do to really calm the kids down. I'm so grateful for Shay and her volunteers who really help our kids to have a better life through this integrative touch.
This is gonna be so much fun! Yes. All right, let's go make toys.
Most of Shay's volunteers come from ITK families themselves. They give their time to other ITK families to keep the program going. On one Saturday afternoon, they gather to make teddy bears for other children who are ill.
Do you think he might be a good friend? Yeah.
When I think about the legacy of Integrative Touch for Kids, I don't care about buildings. I don't care about stuff. I think about wanting to create a community of people who have systems in place that support them in providing love through times of suffering. And if I can help to create mechanisms that enable people in our communities to do that, to rise up and to meet suffering with love more fully, more completely, with more opportunity, then that's enough.
Bree Seward sees the legacy of Integrative Touch for Kids every day in her boys.
What's important for me is having my boys see the outpouring of community and service that ITK brings. And I want them to grow up being a part of that. Just day to day, getting to the next thing was difficult. And now that we see them blossom and grow, and to be a part of, a place like ITK that gives them an environment, a loving, peaceful place to grow and share with other families' experiences and help each other. It's just the biggest blessing, and we value it so much, and we're very grateful